Yeah, Air Zermatt is quite a different rescue organization. We perform around 2,000 helicopter rescue per year with 2 helicopters. During peak season, we have 3 helicopters. Zermatt is based really in the middle of mountains. All around there are 4,000 meter high peaks, so quite a good playground for a mountaineer.
Welcome to the World Extreme Medicine podcast, and in this session we are speaking to Rebekka Frieden on her experiences as a flight paramedic with Air Zermatt in Switzerland and on Denali, one of the gnarliest 7 summits in Alaska. I'm Ffyon Davis. I'm an emergency doctor and expedition doctor, and I'm going to be your host for today. So welcome to the podcast, Rebekka.
Thank you for having me.
Great. So a little bit about Rebekka. She started her career as a medical technician before qualifying as a paramedic in Switzerland. She completed her master's degree in mountain emergency medicine and then started working as a freelance flight paramedic, which led her to working as the lead critical care and flight paramedic on Denali. After working freelance for around 3 years or so for Air Zermatt, she now works for them full-time and is their first female paramedic. So super excited to have you on the podcast and hear some of your experiences.
Thank you for having me on the podcast, and I'm really excited for it.
So we're just going to start with some of your career highlights. So could you talk us through some of the best bits of your career, some of the memorable bits?
Yeah, I can do it, sure. I think my time as a lead paramedic on Denali the Denali National Park, and my current job as a flight paramedic for Air Zermatt are my absolutely 2 highlights of the career. I was at Mount Denali in 2019. Mount Denali is one of the 7 highest summits in this world and is 6,190 meters above sea level. Mount Denali is the highest peak in North America. And I spent 5 weeks on the high patrol. That means you climb up the mountains on the normal route on the West Buttress and are in charge of all the medical cases in this region. It's absolutely a beautiful mountain, and it was such a great experience. Yes, the other highlight is my current job as a flight paramedic by Air Zermatt. And I'm really thankful for the support from friends along this way. For me, it's an amazing opportunity to work for Air Zermatt.
Yeah, so 2 amazing jobs that you've had there. So maybe let's just talk about Denali first of all. Mm-hmm. So what were maybe some of the memorable cases that you saw, or the sort of common things, and then maybe some of the best cases or the really sort of gnarly cases that you saw on Denali? And does anything stand out to you?
Yeah, so a couple of things stand up. I spent 5 weeks on the mountain, but I think at first I have to explain what it means. Denali is really special. You fly into the base camp from Talkeetna. That's a little small village, mountaineer village in the middle of nowhere. Talkeetna is the next town. It has a little airport. There's also a helicopter station for rescues. It's just an A-star with a pilot, no medical equipment at all, no paramedic, no physician, nothing. And it took you from Talkeetna to the base camp. It took you around 40 minutes with the plane, around an hour with the helicopter. As part of the patrol, we spent 4.5 weeks on the mountain, including 1.5 weeks in the medical camp at 14,000 feet. So it's around 4,350 meters. During this time, we had a lot of HAPE and HACE patients and a couple of traumas, but not really serious traumas. One of the most memorable cases for me was a 32-year-old man with HAPE at the medical camp. His friends brought him to the ranger camp with a saturation of under 50%. And yes, he had a really serious problem to breathe at rest, some tachycardia and crackles on auscultation of the lungs. It was bad weather at all, with snowstorm and less than negative 30 degrees Celsius. So we couldn't bring him to a lower level or fly him out. So we decided to stay at the medical tent. There we had the opportunity to heat it up a little bit. So it's quite good opportunity, and we have more resources for treatment there. We had some local protocols and gave him oxygen, put him into the transportable hyperbaric chamber, and administered 20 milligrams of nifedipine every 6 hours. The hyperbaric chamber was a good decision, and after 45 minutes in the chamber, his saturation rose to 60%. So still low, but much better than an hour ago. And the portable chamber is relatively narrow, and it gets quite warm when the patient exhales. So the most of the people cannot tolerate it for longer than 30 to 45 minutes. So in the following 12 hours, our treatment plan was quite simple. So 30 minutes in the chamber, 30 minutes break out of the chamber. And the next morning we received a long-awaited radio call, that the helicopter can fly in and will be in the medical camp approximately in 3 hours. So the case was so memorable for me because it was my first serious HAPE patient, and we had to take care of him around 16 hours. So I work in the pre-hospital field, so I have my patient around 30 minutes to 1.5 hours. So it was it was good experience for me. And after the 16 hours, we could fly him into the out of the medical camp to base camp. Yeah. Another memorable case was just 2 days later. We had split our patrol into two groups. We were a patrol of 4 people, 2 Americans, a Nepalese guy, and myself from Switzerland. And we had to split it because there was a rescue from another patrol in the area of the summit. So our ranger and I were waiting in the medical camp for the patrol who was coming up on the same day. And our Nepalese guy and the other American at pararescue chamber from the States went up to high camp. Yeah, the ranger and I started to ascend the next morning from medical camp at 4,330 meters above sea level to high camp, which is around 50,200 meters. And the ascent begins with a little hill up to the fixed lines. After the fixed lines, there is a ridge which stretch just below to the high camp. Up to the point where the medical is, you can climb up with backcountry skis, and after that point, you have to use mountaineering boots and crampons when you work for the national park. So it's just safety-wise. It was tough for me on the mental side with really bad weather, windstorm. There were harsh conditions, and with a really heavy backpack. And the ranger was in front of me and was taking frequent breaks to breathe. At first, I was very happy because I didn't feel pretty fit for myself, and welcomed the breaks pretty much. But eventually, I realized something was wrong. The ranger was climbing up this mountain for the last 10 years. So I went in front of him, and my shooting wasn't understood because of the wind. And he said everything was okay, but that he was having more trouble than usual. I measured his saturation, and it was 80%, so quite good for this high altitude. But it didn't get any better with breathing, and unfortunately, I could not reach my colleague in the high camp via radio, so I had no reception. Getting down was also not really an option because visibility was getting worse and the wind was getting stronger, much stronger. And the ranger assured me that the high camp was right behind the next hill, whatever that means. So we managed to go up to the high camp, and I was by myself. I was really exhausted. Luckily, my colleague had already been up there for a night. And had kindly set up a tent for us, so I had time for a good assessment. And right now, on the high camp, his saturation was now 60%, but with really shortness of breath, a little bit of crackles on auscultation of the lungs, and really, really low blood pressure. We gave him some oxygen, 20 milligram nifedipine every 6 hours, and tried to figure it out how we can manage his blood pressure. I thought it was a combination of HAPE and dehydration. And on the high camp, we were very limited with medication and treatments. And because of the bad weather, it wasn't possible to fly him out. We had one frozen IV solution and another 150 mountaineers at high camp. So, yeah, what will you do? Give the solution to your friend with low blood pressure and some HAPE, or do you keep it in reserve for the night? We decided to keep the IV solution in reserve and try to increase the blood pressure with oral fluid administration, and that was working out pretty well. And in combination with oxygen and nifedipine, my friend's getting better and better. So we spent the night in high camp, and then the next day he was able to climb down to the medical camp with our support. And in the medical camp, he felt much better, and we spent another 2 nights there. So, but yeah, it's always the question. You have very limited medical gear and treatment, and you have another 150 people up there, so it can happen a lot. So it was quite memorable for me.
Yeah, definitely. And given that he's the ranger as well, and he'd been climbing on this mountain for 10 years and he'd been fine, you wouldn't expect that, would you? So I bet that was a bit of a surprise.
It was, yeah. But I think, yeah, I was happy me getting sick, but it's in this high altitude, it can happen to all of us. So as well on the medical team, it can happen as well. So
yeah, and like you said, you then had to make that decision about you only had limited kit. Are you going to save it for the other climbers, or are you going to give it to your friend? And it sounded like you couldn't get down either because you had to go up. The weather was too bad further down.
It was too bad to go down. Yeah. Yes, it's a small ridge where you have to climb down, and it was not possible because of the wind, and we had so bad visibility, so it will be too dangerous to go down. Yeah.
Wow. So the weather on Denali is pretty notorious for being terrible.
Oh yeah.
So what sort of conditions did you have to deal with?
Yeah, the weather is changing a lot on Denali. You can start in the morning with beautiful sunny weather, blue sky, and an hour later you couldn't see your own hand in front of you, of your face. So, but we were really lucky, and most of the time we had good weather conditions. But yes, it can be very cold. The coldest temperature that we had during my time, during these 4.5 weeks, there was a negative 40 degrees Celsius with a snowstorm. So we can imagine how cold it was. So you have to make sure that the medication are not frozen, and that you and your team stay warm and don't get any frostbites. I think anyone who has been on an expedition before recognizes that it is mental challenging, and you're already pushing your own physical and mental limits. And then there is additional difficulty with high altitude. Your saturation will be around 80 to 90%, and you are exhausted from climbing all day up to the camps. And then on arrival to camp, there is a patient who needs some help. So it's both. It's the weather conditions and the high altitude were really challenging. Yeah.
Yeah, and you just mentioned there that the fluid had frozen. Do you have any hints and tips on how to keep your medications and fluid not frozen?
Take it on your body. The medication where you prepare, take it as nearest to your body as possible. And the other medication we had in huge boxes with warm fluids, so we cook it up all the time. So yeah, it was challenging. And in the medical camp, we had a heater system in the tent, so with propane, and so that was quite a good solution. Yeah.
And is the medical camp set up all year round, or do you have to carry in all the kit and then put up the tent and everything?
No, we have on Denali. There's a climbing season from middle of April to middle of July, and the medical camp were already set up from the U.S. military. So you have the cooperation from the National Park and the U.S. military. They set up the medical camp. Then bring up all the medical equipment, the gear as well, and as well the medications. Yeah, and when you climb up the mountain, you have to set up your own tent. So until the medical camp, this one is fixed, and the rest you have to prepare by yourself. Yes.
And you mentioned that you had an altitude chamber at the medical camp, right?
Yes, at 4,300 meters you have a portable altitude chamber. You have as well ski ladders, some splinting material, rope, gear for crevasse rescue, including instruments to knock the patients out of the ice, some avalanche gear, as well medical equipment for airway management, for ACLS, for PHLS treatments, pain medication, treatments for frostbites, medication for pace. So on the medical camp, you're pretty well prepared for this.
And I guess you guys might be stuck there for quite a while with the weather being kind of unpredictable and bad as it was. So like you said, you were with that guy for 16 hours or something. That's a long time to be looking after a patient. I bet you were exhausted.
Yeah, it is.
Great. Okay. So what do you think that your sort of main learning points were from Denali? Because I think up till then you'd worked in Switzerland, you'd done your mountain medicine masters, hadn't you? And then you went and sort of put it into practice on Denali. So what do you think you took away from it?
Denali is an incredible place to learn medicine, especially high altitude medicine. In addition to treating pace, AMS, frostbites, I learned to provide treatment with minimal gear. So and less material than I would normally have access to. So, and you have to improvise with less gear, as well as less treatment that you had in normal ambulance service or on the clinic and the hospital. So, and while treating patients, I learned a lot about myself as well. I learned how that I can treat patients even while pushing my own physical limit and mental limits as well. So until the expedition, before I've done my master's degree in mountain emergency medicine. They have a couple of externships. But you know it from the theoretical side, how a HAPE is working or how a frostbite looks like, but you never saw it in real life.
Then you went on to work for Air Zermatt, right?
Correct, yeah.
And for those of you who might not have heard of Air Zermatt before, I first heard about it through the Netflix documentary called The Horn. I think, unfortunately, it's not on Netflix anymore, but I'm sure it's on some corner of the internet out there somewhere. But The Horn showed some of the sort of rescues that Air Zermatt do. Obviously, they're based in the Swiss Alps. They see a sort of variety of medical and trauma patients throughout the year. They do crevasse rescues, they do avalanche rescues, they do altitude illness and mountaineers, and even down to sort of trauma on the ski slopes. They see a whole range of presentations. And they're mainly a helicopter-based service. In fact, entirely a helicopter-based service, but you've got a couple of different ones, right, that you use depending on the rescue. And I was lucky enough to meet Rebekka at a conference in Zermatt this year, where they demonstrated some of their rescue techniques, which were really fascinating. And one of them I wanted to talk to you about was the dynamic winching, which is not something that we do a huge amount in the UK, but I do understand is done in the US a little bit more. Yeah. But maybe for people who don't know what dynamic winching is, do you want to talk us through it, and then when maybe you might use it in your sort of setting with Air Zermatt?
Yes. Air Zermatt is quite a different rescue organization. We perform around 2,000 helicopter rescue per year with 2 helicopters. During peak season, we have 3 helicopters. Zermatt is based really in the middle of mountains. All around there are 4,000 meter high peaks, so quite a good playground for mountaineer. And here at Air Zermatt, we only do dynamic hoisting. With dynamic hoist, you have no spinning for the recovery back through the downwash. So due to our area, Air Zermatt started dynamic hoisting since 1968, so quite early. And we also use this technique for pulling patients out of canyons or the forest. The helicopter picks up the load, climbs above the obstacles, and once the helicopter has a good and stable forward flight, then the hoist is getting released in. So we don't do static hoisting at all and never use a tug line. So, and when you have the forward speed, you get out of the downwash and then you can reel in. So it's, for us, it's normal work, and we were a little bit scared about static hoisting, but yeah, different system.
Yeah, I think the helicopter has a little bit less control in a static hoist, doesn't it? Because it has no forward movement.
Mm-hmm. Mm-hmm.
And
Yes.
you guys, because you're rescuing in a lot of sort of technical environments, you know, the Matterhorn is one of your mountains as well, the Breithorn, and you sometimes picking up mountaineers off very difficult technical ground. I suppose a dynamic hoist is much more useful in that sort of situation than a static hoist.
Yeah, you couldn't have a person down on the ground with a tag line. That's not possible in most of the areas with steep rock walls, or yes, that's in the mountains.
And so once you've sort of picked up your patient and you're flying off and you're hoisting them up to the helicopter, when does sort of treatment start?
It really depends on the missions. Most of the time, we have to pick the patients away from the environment, because it's not safe for us because of rock falls, of avalanches, and then we go to a different spot and land there, put in the patient to the helicopter, and do our treatment on scene, or most of the time during flight, so that we don't lose any time.
Yeah, and that was something really interesting that came up at the Big Sick conference, was the fact that you guys RSI in the back of the helicopter, whereas a lot of other helicopter services don't do that. But I think one of the good points that came up was that your environment is so harsh and it's so cold and it's so dangerous that you're much better off doing a lot of your treatment and procedures in the back of the helicopter. Is that right?
Yeah, in our rescue helicopter is the Bell 429, and there's plenty enough room above the head of the patient to intubate them. We work in this region with all the mountains, so for us it's easier to intubate in the helicopter because it's warmer than outside, no snow, no wind, and all your gear is at hand. So it's much easier to bring the patient inside of the helicopter and do the treatment during flight than when you have to bring all your gear, all your equipment, the respirator, all of the stuff outside of the helicopter. Yeah, it's more comfortable, it's faster, and it's easy trainable. So.
Yeah, it's really interesting to hear that, because I think in the UK, obviously, we don't really think about doing RSI outside the helicopter. Inside the helicopter, because we don't have a lot of space, and but I suppose your environment is actually so different that it's actually just much better just to bring the patient in the nice warm helicopter, isn't it?
It is.
I heard stories about your ketamine freezing, and so that's not ideal in an RSI situation, is it?
No.
And then you mentioned that you've got quite a lot of sort of high mountains, about 4,000 meter peaks and everything. And how does that affect the helicopter? Yeah,
the high altitude is much more a problem in summertime with warmer temperatures. How much a helicopter can transport depends in particular on the air density, which is calculated from temperature and air pressure, and the performance drops at low density before, of course, with increasing temperature and altitude. This is why helicopter can transport significantly less weight in hot months, so during summertime, or in thin air in high altitude regions, than in cooler temperature or lower altitude. So.
And I remember you guys saying that you sometimes need to strip quite a lot of kit out of your helicopters in order to actually get to the patient to start with.
Yes. During summertime, we strip up 2, 3, 4 times per day the whole helicopter. So all the chairs, the stretcher, a lot of the medical equipment as well, and go out of the helicopter. And then first thing is to rescue or to bring the patient in a safer spot, and then you can start with medical treatment. Yeah, sometimes hard.
Yeah, I think it's what's so different to sort of expedition or mountain medicine compared to sort of in-hospital medicine is that the environment is so difficult. A lot of the time, your priority is not airway; it's get the patient off the mountain before you can do anything safely, right?
Yes. Yeah. You have to bring him out of the rock wall or of the environment because of your own safety.
And you mentioned rockfall. Is that more of a problem for you than, say, avalanches or crevasses?
It really depends on the time of the year. So avalanches are more often wintertime, more often the problem. Rockfalls more often in summertime. It's really, we have 2 seasons, summer, winter. We have more crevasse rescue in summertime during mountaineering season, more avalanches in wintertime, but it can be an avalanche in summertime as well. So there are as well snow, glacier, so yeah.
Have you noticed any differences in the type of rescues that you're going to in maybe the summer or the winter with the climate, with it being a little bit warmer? Are you getting more crevasses opening up?
Yes, I think last summer we had a lot of crevasse rescues because the winter was pretty bad. In Switzerland, last winter we had less snow, really low snow level, and so the glacier don't get covered with snow. So in the summertime, everything was open. The bridges were not stable. It was quite warm. So as well, I'm private mountaineer, so I've done quite last summertime because it was so scared to go on the glacier. So yeah, the climate changed a lot. I think so. But
yeah, and you're somewhere that you're really going to notice it, I think, maybe more than other places.
Yes. Yeah.
So, you mentioned crevasse rescues, and how would you guys go about setting up and preparing for a crevasse rescue? And do you take any other rescue team members with you when you're doing that sort of a rescue?
Yes. During crevasse rescue, it is often not clear what the extent of the patient injury are. Everything is possible, from injury to severe polytrauma or death. The most important thing for us is to bring all the gear to the scene of the accident first. So it's included a tripod with a block and a tackle, various pickaxes, and if it's necessarily a generator, to power tools for people who are trapped. So a patient can sink deeper into the crevasse and become trapped to the melting ice from their own body heat. So you can imagine it's a lot of work to bring them out of a crevasse most of the time. So usually we take 2, 3 rescue specialists with us. There are local mountain guides who are trained with us, so we have some manpower on scene. Yes.
Great. And it sounds like a lot of kit to take up to the scene of a rescue as well in order to actually dig somebody out. What sort of learning have you taken from crevasse rescues? And I guess what I'm getting at is how many actually have good outcomes, and do you get the person out, or how many of them are sort of resulting in fatalities?
Hard to tell you some numbers, but I think it's, yeah, as I told before, it's everything has happened. You can have a crevasse accident with a fall with 20, 25 meters, and they are uninjured, and you think, what the hell is going on? And then you have another call, and they are dead. So everything is possible with crevasses. It's hard
Yeah,
to
it just
tell.
depends, doesn't it? And you mentioned there that the crevasse tend to be sort of bigger at the top, smaller at the bottom, and the patient kind of slides further in as their body heat melts the ice.
Sure. In Switzerland, we have really small crevasses as well. As I worked for Denali, for the national park, we had huge crevasses. I never saw these huge crevasses before. They are 10 meters wide and really steep, so I'm happy. But as well in Switzerland, they are smaller, but as well they are really steep, and sometimes you can't find the patient at all. So.
Yeah, crevasses scare me to death. So 10-meter wide crevasses sound terrifying.
Yeah.
Great. Okay. So then I guess I was just going to ask you about, did you have any sort of memorable cases from Air Zermatt that you've been involved with that you think, yeah, that was a really great case?
Yes. There are a few missions that I remember. I think one of them who were really picked up was my first night hoist. It was 4 a.m. and when I got the call, and I was really a bit scared. And the only information we received was that the climber had fallen on his way up to Ffyon. So it was summertime. The mountaineer starts really early on 2-3 a.m. To climb up the mountains, and that's a summit in our region, and it's 4,490 meters high. So due to the warm temperatures and the high altitude, we decided that we would leave the physician and most of the medical equipment at the base. I know, I see your face. And yes, most of the medical equipment are the stretcher, chairs, respirator. We all ripped off the helicopter and leave it at the heliport, so that we would possible to hoist at this high altitude. Such a mission, I always take a small medical backpack with me, just for the first medical treatment. And the helicopter and the team were ready. The team on this morning consists of a pilot, a rescue specialist, and me. And then we flew towards to Ffyon. On the approach, we got an idea of the current situation. We were able to locate the uninjured friend on the top of the ridge itself, but it took a while until we saw the climber. It was about 300 meters below the ridge, in a corridor with a lot of loose rocks, and unfortunately he wasn't really moving at all. And we decided to evacuate his row partner on the ridge before going to the patient. The reason for this was the high risk of falling rocks. So you won't operate under a ridge where there are some people up there, and but easier said than done. In the meantime, the wind had increased, and it was already difficult to place the rescue specialist exactly on the ridge. And you may remember, it was my first real night hoist mission with a patient. And the rescue specialist detached from the hoist as soon as he stays safe, and the helicopter flight away until the rescue specialist and the mountaineer are ready for the evacuation. So evacuation too was more difficult than expected due to the wind. It took us two times before it finally works out. Due to the conditions, especially of the wind and the risk of the falling rocks, we decided to wait 30 minutes at the heliport until the sun came up and try to rescue again in daylight. And half an hour later, we set off again towards Ffyon. and in the meantime we had daylight, and the wind was also decreased a little bit, and we were able to get to the patient fairly quickly and fly him out of the corridor. Unfortunately, the patient suffered very severe head injuries, and which were incompatible with life. So at the end, it was about body recovery, but for me, it was standing up because of my first night hoist, and it was quite difficult.
Yeah, it sounds like the conditions were really challenging. And I guess it was, interesting that you guys went for the friend first, because he was on the ridge above. You didn't want any rocks falling on the guy that had already fallen. And then go back for and it's always about your safety first, isn't it? And then safety of the helicopter and the crew, and to help the people that you can help the most, I guess, and get the friend to a safe situation, the climbing partner. Yeah. Yes. And had he fallen the full 300 meters down the ridge?
Probably, yeah. Yes. So, you can imagine there's just a small chance to survive this fall, and as well, he was lying quite uncomfortable. So, and when he wasn't moving at all, and when you work in this corridor and you have on top another guy where you not really know what he's doing at all, we had a lot of falling rocks, so our safety is the most important part on this mission. Yeah.
And I guess you don't always know when you're going what condition you're going to find the patient in. I wouldn't imagine his friend knew whether or not he was okay or not.
No, we don't know. We had only, when we get a call, especially on this mission, we only knew that it was a climber who was falling down this ridge, but nothing more. So we don't know the condition of the patient. We don't know the environment. So we have to decide really.
Yeah, it's a lot of dynamic decision making, isn't it? You don't know till you get there what the wind's going to be like, what the cloud's going to be like, the condition of the patient. So you have to make a lot of decisions in the moment, I guess. And
but it's always a crew decision. It's always a decision on the whole crew, and I
was going to say, do you guys as paramedics, do you sit in the front and do you have that chat with the pilot and you say, okay, like he looks like he needs our help really urgently, can you put this down as soon as possible? Or is it kind of a how does that?
It really depends. When you in Switzerland, it's special system. As a paramedic, I'm as well a hoist operator, and when we know there is a huge chance that we have a hoist, then we are sitting in the back when we fly in. So you open the door and have a look on the casualty and do the decision during the flight, and speak up with the team what they mean. So
team approach, chat with the pilot, see what you think. I like that you kick the doctor out first.
Sorry.
It just shows how valuable we are. Gosh, take the paramedic over the doctor every time.
I'm so sorry for it, but on these missions we there's all extra weight we have to limit it, and we have to pick up the patient first and go away from this environment as well when he's still alive and has some bad injuries. So we have to grab him out of these conditions, and then the treatment can start.
grab and go rather than
and pick up the physician and medical gear and go to the next hospital. To the next trauma level 1 hospital.
Yeah, cool. That's a really good case. And then I think finally, as we sort of just bring it to a close, there was one final point that I know me and you have chatted about before, but about being a female paramedic in a sort of HEMS environment, and I guess on Denali as well. In a lot of these situations, it's pretty unusual to be a female. There's not that many people in the industry. There's not that many women that do it. And it's absolutely awesome that you're out there doing it, representing, doing it for the women. And I just wanted to ask if you'd come across any particular challenges or kind of, as being a woman in the industry, have you come across any particular challenges?
Yes. Yeah, I had to improve myself for every job first. Maybe a little bit more time than a man had to. But after I was accepted, and I didn't have any major issues. I'm not faced with more challenges in this industry than a male flight paramedic. So,
yeah, I think that's fair enough. And I always kind of it's a little bit cliche to talk about, it must be so hard to be a woman in this industry. And, actually in some ways it's a real leveler, because you can either do the job or you can't do the job. And that's kind of it, isn't it?
I think it doesn't, I think it doesn't matter if you're male or female flight paramedic. You must be technically and physically able to do the job. And so that the patient receives the best possible care. So I think the patient doesn't care if there's a female or a male paramedic on board.
Yeah, as long as you can do the job, that's all that matters, isn't it? Maybe you just have to train a little bit more in the gym to lift the weights and everything, but you're strong. Yes. I know you can do it. Cool. Okay. Well, I think the last thing I just wanted to touch on was, no, there aren't that many females in this industry, and it's great to have some sort of role models out there. And I'm sure there'll be some paramedics listening to this who think that your job sounds amazing and they would just love to be you. And would you have any advice to give to those kind of paramedics listening?
I think nothing is impossible. Sometimes it's a long, rocky road, but you can do it if you believe in yourself. I've invested a lot of time, be it for future training, such as a flight and critical care paramedic, my master degree as well, and some additional courses. I was also aware that the job requires a lot of muscle strength from me, so what you talk about from the gym. So I also prepare myself pretty much to do the best possible job with endurance sport, CrossFit, weightlifting several times per week to ensure I'm able to carry the patient and load them inside the helicopter. I think I also speak openly about the path I have taken to hopefully give the following female flight paramedic an easier start in this business. And I hope that in the near future it will no longer matter what gender you are, as long as the job is done professionally.
Absolutely. Yeah, that's a great note to end on, I think. It's been fab talking to you, Rebekka. And we met at the Big Sick conference in Zermatt. Yes. Absolutely fabulous conference. I highly recommend. And if you want to go and learn more about what Rebekka does with Air Zermatt, it's a great place to go. I think they do some mountain medicine teaching as well there, don't they?
Yeah, we have some mountain emergency medicine courses in summer, as well in the winter time, as well the helicopter crew member course, the HAMS course. So yeah, would be nice to see you guys up there.
Absolutely, and the skiing is pretty good as well.
Yes, the mountaineering as well. In the summertime.
Yeah, maybe next year. Maybe next year.
Okay, nice.
Lovely to talk to you. Thank you so much for coming on the podcast. And there's lots more educational content on the World Extreme Medicine website, including the recent webinar on pre-hospital cases, which kind of links in with this podcast quite nicely. And there's more podcasts to come. So keep an eye on your emails, keep an eye on the website. Thank you so much, Rebekka, for taking the time to record this.
Thank you for having me. Thank you very much.
Thanks for listening to the episode. Please feel free to rate, review and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website, where you can find more engaging content on extreme medicine webinars and indeed the collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical and performance medicine. Thanks again.